us does not really mean that I'm living for myself. No, us here means that we are living for myself, for you, for our parents, for our community. So collectively now, we are living for us. That also steers the thought that we cannot always be independent. There is always somebody that we can reach out to or help ourselves or even collaborate to do something in our community. And this is what inspired the project itself to be able to be the We Live For Us project. We thought about the curriculums that already exist for students' mental health, for youth mental health, for adolescents' mental health. And we set these things out. And we decided that we need to move together to kind of read through all these curriculums and find the best suited model that can be able to have the best impact on youth mental health, especially if we train these young people to have a practical skill, to have, basic soft skills that they would want to use for themselves and their community at large.
I just saw mental health as something which was a challenge, but I didn't even know the intensity of it. But when I came for training, I realized that mental health is a real issue, not only in Kenya, but also globally.
I thought, mental health is a sickness. It's a curse because it is not logical. Me walking along the road, then I see this man coming running, either with staffs carrying along the way. Based on the training, I think that perception is gone because I thought that mental health awareness is about now the illnesses. Just realize that actually the well-being of a person that enables one to do their normal functioning.
I've only attended one training in Nairobi for the youth, which was organized by the Kenya Council on Psychological Education. So I was very happy when I was called for this training to train the youth on psychological first aid. I think we need the youth to be out there to give psychological first aid to the other youth. Sometimes when adults are called to give first aid to children or the youth, they don't feel comfortable. But if we train many youths all over the country, I think it's a program that will really help the youth. And most of them are undergoing traumatic experiences from various areas. So I think with this psychological first aid, it will help the youth very, very much. Especially because of the suicide and what have you. If the rich can reach the youth, it will be easy for them to understand and to work on their stresses and other things that are happening in their lives.
First one of these projects is already done. We have been able to implement it in Mombasa, Kilifi, and Kwale. The aim of this mental health literacy training was to give young people knowledge to be able to identify some of these symptoms that we may see as very common, but honestly, most of young people do not understand them. We were hoping that we would at least change young people's perceptions and beliefs about mental health. And we help destigmatize mental health in the communities. We're also hoping that we will improve on how young people address the stresses of life by coping, improve resilience, and also ask young people to be more kind to themselves and promote self-care.
Before I came for this training, I thought that mental health also affects only people with disability. But after training through our facilitator, who was very fluent in terms of mental health, I'm now understanding that mental health is an issue who affects everybody, individually, in different capacities. We at the Coast Association for Persons with Disability are going to make sure that this knowledge is spread through the networks, because we know we have different groups of people with ability per sub-county or per ward. So we are going to see how we can have a work plan and reach to them, because many of them know that when we are talking about mental health, they are only talking about disability.
The 3 days training have been really, really of great help. We've learned a lot of issues, how to deal and go about in case one has issues to do with mental health, where we can get help. And they were also able to share the toll numbers that one can be able to call anytime. And for those who are not maybe able to meet at an individual level, at least that one helps them and they can share out the issues and be able to be heard and be listened and also get help from there.
I had an idea of starting a mental health program with my CBO, and I'm really glad to be part of this training, which is coordinated by Kenya Red Cross and International Mental Health Association. because I'll gain so much skills that will not only help me as an individual, but will help me when I go to the field and while undertaking the project as well.
The training that we have had in Kilifi County, it's going to raise and create more awareness on mental health issues, and with the support given to the various youth in the relevant CBOs in the county, it's going to really help and assist them to reach out to their fellow youth who are facing these mental health issues, and it is going to help a big deal in creating more awareness and reducing the stigma and discrimination associated with mental health issues.
I really loved everything about the training. The facilitators were good, they are youth. We had fun, we had energizers, we had good food. And the sessions were so incredible. It was a good experience for me, and I would love that we can do more and more of this training at the community level.
The training is good, but I feel that we should add basic counseling skills that can help this youth to deal with the people in the community.
A lot of our healthcare providers don't have the information to do with mental health. So we would really appreciate if IMHA and Kenya Red Cross would at least train one healthcare provider who will be based at the hospital, where if young people come and share out their issues and what they're going through, is able to relate with them and even be able to refer them to the right place where they can be treated or even be on medication, and maybe any other psychological and social support can be offered.
Going forward, we are planning to have a phase 2 of this project in Tana River, Lamu, and Taita Taveta counties. I am very grateful to the Kenya Red Cross Youth Department for the partnership with the International Mental Health Association. There is a clear need for investing in mental health. I cannot do this work alone. You cannot do that work alone. But if we come together, align our objectives, there is a very high chance that we will do more, reach more people, and improve the mental well-being of our society.